All right, Dr. Stepter, that button in the middle it says that we are live.
I
Welcome,
see.
welcome to our show. Welcome to Tea Talks. It's so nice to have you here. Even just in the few minutes just talking and getting to know you before we got on here live. I just love your personality. So welcome to our show. And I will
Yes,
I'll ask you at
thank
this
you.
point to introduce yourself. Just introduce yourself to our audience.
Oh, thank you, Sharon. I'm happy to be here. I am, as you said, my name is Clesha Stepter, but everyone calls me Clesha. And so I was admittedly, this is actually my first time doing a podcast, so I am admittedly nervous. And when my when my advisor and mentor gave me this task of doing it, I was like, sure, why not? I'd love to do it. And then she tells me that I have to introduce myself, and I was like, I probably need to update my friends list. I mean, two things that are admittedly the things that cause nauseum when I think about them, and that's personal speaking. I think about 75% of the public have a fear of public speaking.
I
And
think it's
then I
higher.
read a report. Yeah,
I think it's
I
higher.
actually I think it's high. Yeah, so I definitely fit in that category. And then I read a poll at one time where 25% of people hate talking about themselves. So that's two things. The fear of public speaking. Yeah, 75% don't like public speaking, and then 25% of them, don't like talking about themselves. So 75-25, I said it's 100% chance that this is not going to go well for me.
Oh, I doubt that very, very highly. First of all, if you have
Yeah,
a mentor that's
yeah,
pushing you to get out of your comfort zone, that's a mentor you want to actually keep, right? So, because
absolutely.
it's all about growth. And yeah, I think they said that public speaking is, other than death, after death, it's the next highest fear.
Right. Well, don't worry, Sharon. I am very optimistic. I am an optimistic overthinker. So when I add the math and I do 75 and 25, I figure about 100% of anything is a good start. So
Yes,
yes,
you're
but you may call me Cleisha.
Oh, very good, Cleisha. Makes it a lot easier for me. Cleisha,
Yes.
I was telling you before we got on here that I had to do a little bit of a Google search, right? To
Okay.
understand, you know, advanced practice registered nurse. So I want you to please explain to me, to the audience, the difference between an advanced practice registered nurse and a nurse practitioner. What's the difference?
Okay, yes. So an advanced practice registered nurse is a nurse who's gone out and received their master's degree. And their master's degree can be in any field. It could be education, it can be in management, or it can be as a nurse practitioner. A nurse practitioner, though, happens to be a segment of an advanced practice nurse.
Oh,
So I am an advanced practice nurse with a certification in family nurse practitioner. So that's what makes me a nurse practitioner. Most advanced practice nurses have a master's degree, but their master's degree may be in education, or their master's degree may be in management or healthcare business. So that's what the difference is. So they're one and the same, but then it branches off into specialties within the umbrella of advanced practice nursing.
well, we love our nurses, you know. God bless you all.
Yeah,
The
yeah,
topic today is expanding
yeah.
diversity in oncology nursing, one journey at a time. So I wanted to ask you, what is the current, what is the current state of diversity in oncology nursing?
Yes, so the expanding diversity in oncology nursing one journey at a time. My goal today was to just discuss my personal journey and my path to professional growth as a method to introduce and encourage new nurses coming in. And our community has suffered many historical obstacles that have hindered the opportunities for advancement in certain fields and areas in the medical industry. The Washington Informer reported earlier this year that about less than 10% of registered nurses in the United States in the pool were Black. And so for oncology nurses, that number and percentage is significantly lower. There's about maybe 3% of oncology nurses that are registered nurses. And so it's unfortunate because we have these marginalized groups often experience biases in healthcare settings. that contribute and lead to health disparities. And you guys have talked about that many times on your show, and these result in poor outcomes. And so, it's important that we know that increasing the number of Black nurses and healthcare providers will give patients a better chance to work with someone that they can easily identify and connect with. So, I mean, that's significant. Less than 10% of registered in the United States are Black. And so,
Gee, I'm surprised by that number. I don't know.
mhm,
I thought it would be. I thought it would be more.
yes,
I'm really surprised by that number. And of course, you said in oncology, it's even distilled down further to about 3%.
yeah,
Um, so,
yes.
what does expansion look like? In other words, what can we do? What can we do? What are your thoughts on that? What can we do to expand that number? I mean, is it more, I don't know, more PSAs? Is it more education, more more outreach? I'm also curious to know if if what is your thoughts on the why the numbers are so low? So first of all, um, how can we expand that number? And then I'll ask you, what do you think? What do you think is the reason for that?
Right. Thank you. I think I think some of the reason in the research that I've looked at has a lot to do with
Mm,
outreach and opportunity. And that's part of why I'm here today, is so that I can hopefully reach someone who has maybe considered nursing or considered the healthcare field, but they can't quite figure out how to get there and how to get started when we're talking about expanding and exploring their career options. For a lot of Black and minorities, opportunity is maybe not there necessarily. Like I mentioned, there are a lot of historical obstacles that hinder their ability to access and tap into the healthcare industry. Sometimes their schools aren't um, the outreach in the schools when they're young would be a great place to start. Sometimes that is simply just getting the word out and them seeing other healthcare providers like us. They just don't see representation out there. So outreach is going to be a huge um, way to hopefully increase that number, and then showing them how to access it as well.
I guess I'm still surprised, and I
Mhm.
realize why I'm surprised. Okay,
Yeah.
I'm thinking as to myself as you're talking when you with that number of the 10%, because when you go to the hospital, right, you see a
Hmm.
lot of Black women, right? But guess what?
Hmm.
There are CNAs and
Yeah.
HHAs. So
Yeah.
that's where the confusion in my brain, because I've had to, my mom was sick for a while, so I was back and forth in the hospital a lot, and so uh, all of our attendants were pretty much Black or Hispanic,
Right.
but it never,
Yes.
it just didn't occur to me until you said those numbers that, but the actual nurse and the nurse practitioners are not, and so outreach. And why do you think historical, why do you think the historical context playing that? You mentioned about outreach, but I would think that, you know w- we're all in college, right? We have the
Yeah.
chance to pick what we want. Why would that? Why do you think that would affect? What do you think is that would affect the register? People signing up to do what
Sorry
you
to
do.
be registered.
Yeah,
Yeah.
yeah.
I think a lot of it has to do with whether they see the representation or not. I think when we
Mm,
talk about social media and when we talk about what we see out here, like you said, when you go into the hospitals and they're visiting family or they're visiting parents, the people that they see that are working with them are the nurse assistants, or they're maybe the secretary. They don't see many Black nurses or Black doctors. There are some in some concentrated areas, but like
hmm
the area in which I work in, I work in hematology and blood stem cell transplant. I am the only registered nurse and the only nurse practitioner in my clinic. And I'm the only one in the actually in our area. Um, when you talk about a doctor having even a master's degree or even a doctorate degree, there's not one in our hospital that's in oncology, and in our on our floor we only have me, and everyone else are of other races, but there aren't any blacks, and they're all that is important when they're coming in. They come in and they may see the secretary and they may see a nurse assistant, and then there's me, but everyone else there is white. So they're not encouraged to step into that field because they don't have anyone that they see that is of significant importance, or to give them that encouragement to make that leap. So I think stepping out, if we get into the communities, if we share our stories, if
Mm-hmm.
we explain the importance, because one point that you bring out is that blacks, we are our track record when it comes to oncology and most comorbidities are higher than our
Mm-hmm.
white counterparts. I mean, we more than double that with the incidence of cancer and the incidence of most comorbidities than our white counterparts. And so we're a lot sicker. We're in we wind up in the healthcare industry a lot for a longer period of time. But as far as who's taking care of us, it's just not, it's not there, and it's not seen, and they're not trustworthy. They don't trust the healthcare system for
Yeah.
various reasons, and
Y-
that's a whole nother program on its own. But there's just a lack of trust in the black community of the healthcare system. So
mhm. That's sad. It's so sad, Cleisha, because when you were talking about at your, where you work, looking around left to the right, it's you're the only person. And I was wondering about the ratio of black patients that you see in where you work. I mean, do you see 20% of black patients that come in? I mean, because the reason why I'm asking is, as a black patient, if I'm not seeing people who look like me, I'm not saying I don't trust. I'm just saying to myself, wow, am I really being seen? Again,
right.
we talk about, disparities in healthcare. We talk about, you know, um, diversity in healthcare. And I remember as when I'm interviewing guests and they're talking about the diversity, they want, certain treatments, the doctors to understand diversity, and to recognize cultural issues. One of the things that I remember in the past, just hearing certain guests say, but we need workforce diversity. And that's exactly what we're talking about today is workforce diversity. Let me just see what Sarah says here. Less than 10% of nurses are Black, even less than oncologists. This is a frightening statistic. Less than 4% of oncologists are Black. This is really a root of why disparities continue. So proud of your representation, Dr. Stepter. And then Sarah
Thank you.
said again, only 40% of Black students graduate from four-year universities and colleges within even 6 years, compared with 64% of white students. I mean, these are poor statistics, and
Yes,
as we mentioned, we're seeing the disparities in healthcare. We're seeing the lack of diversity and the lack of understanding. But I believe that there should, this is me, okay, that there should also be some responsibility on the institution side to recruit, to actively
yes,
recruit and encourage, Black nurses, Black nurses like at your level. And that's
yes,
easily done. When my husband was in law school, there were people coming there and recruiting and recruiting and recruiting actively who they
yes.
wanted to. So I don't see why the medical community can't do the same and make it known that we are actively looking for this type of person, because we want to increase representation. What are your thoughts on that?
Absolutely. And that's part of the outreach that we're talking about, is that you there has to be a concerted effort to
Mhm.
recruit Black nurses and Black healthcare providers so that we can have better outcomes. And as I mentioned, the statistics show that, anytime that if for every 10% increase in Black healthcare providers, it was associated with that 1.2% lowering of disparities between
Right.
blacks and whites. So with that, you know that there's definitely a need. And you mentioned earlier, and Sharon asked about my population.
Yeah.
I live in a tri-state area in Memphis, in which we serve patients in a tri-state, fairly rural area of Tennessee, Mississippi, and Arkansas. And so our county is majority Black, with an increasing Hispanic population. So our patient population is much greater. Is about, I would say, where I am currently working, it's about 40-60%. Where I
Wow.
worked before, it was flipped, and we were majority Black patients, and you didn't have much representation at all. So our patient population, and when compared to the providers don't reflect what our patient population is. And that's discouraging to many people who are coming through. And like I said, because we suffer with these diseases for such a longer period of time, and at such an alarming rate, that when they see and walk into the healthcare and they get introduced into the healthcare industry, what they see doesn't reflect what's what their community is about. So, yes.
That, when you mentioned you work in Memphis, that's even more upsetting to me and shocking to me that you should again, it should be that the healthcare workforce represent the community. So there should be not one in not just you, but many more times you, because there's many more times Black people and Hispanic people who are working in the field. So that's really, again, really a head scratcher for
Right.
me. And I'm thinking everything rises and falls on leadership. That's,
Yes.
somebody smart said that. And I'm just thinking, like, in a state like in a city like Memphis, Tennessee, for example, again, you wonder where the leadership is in terms of, wait a second, I'm looking around and we have this Black population and this a lot of big, Black patient group, but we only have Clesha over here. We need to go to these high school level and encourage nursing. Or that's the, like we talked about, that's that emergency testing. So everyone should be getting this on their phone and television right now.
Yeah.
But so yes, so again, Clesha, it is. I'm glad you're pointing this out to us. What what else can we do? I mean, again, I really believe that a big part of this should be on institutions. Just like when big law firms want to recruit, they go and they find the people. I feel like this should be the same thing that's happening in the medical community, where they go and they really research and encourage that minority participation. There's so many things that can be done. I think it's just crazy.
Yes. Well, you mentioned something that's very it's interesting you brought up leadership, because
Yeah.
when I talk about Memphis and where I live, um leadership in the city really makes a difference in how funds are allocated, and
Yeah.
how different things are the access that people have. When you talk about workforce diversity, social exclusion exists in a lot of these areas, and poverty, low
Hmm.
income
Hmm.
jobs, and environmental hazards. There's so many things that contribute to why you will see nursing and minorities not even going to college. When you talk about the college rates and the rate of
Yeah.
dropout, so when you talk about the socioeconomic disparities that exist, it's not just affecting healthcare. A lot of it is unfortunately political, and these political divisions are historical, and they've been around for decades, and
Hmm.
they have a big grip on our city, and that is what is the driving force behind what decisions people make, in what careers they go into, or how they
Hmm.
pursue college or secondary learning.
Hmm.
Honestly, you have a lot of people who just aren't going to take that conventional route to going to school, which is part of what my journey was. My journey was extremely unconventional, I had to piecemeal, my
Mhm.
education together in order to get where I am. And I'm sure a lot of young Black and Hispanic and minorities could say the same thing. So and during that time, I'm trying to help raise a family. I'm trying to go to school and trying to balance it all. And in between time, you're stopping, you're starting again. So you'll see, as Sarah pointed out in her message, well, there'll be a higher dropout rate because you have to stop and you have to go back and help family, or you have to start again because someone gets sick. So
Mhm.
the leadership in a city and the politics can make a huge difference in how the workforce force diversity is allocated within a city, and that is a big part of why you see a lack of a diversity in having Black nurses, especially in the Memphis area.
I agree. I know sometimes, what conversations as a Black woman, I know sometimes conversations around equity and diversity and disparities. I feel sometimes like that it may be annoying, to some, because it looks like it's always an excuse, and we don't have the time to go into to all that historical
Yes,
context. Like I said, certain professions, when they want what they want, they're going to recruit. I really
absolutely.
believe that it is a leadership issue, both on the state government side, it's also in the hospital settings, because there is a hospital administrator who can look around and look at the roster and say, we are not, we're not representative of the community in terms of our workforce. What are we going to do about it? And begin a really robust enrollment, outreach effort that can be done. It's just a matter of choice, it's a matter of interest, it's a matter of will. And one of the things Sarah and I, we talk about, this diversity programs are hard. They're hard because people talk about it, but they don't spend the money toward it, and so we will continue to have these results where it's you, when you look around, it's just you yourself in a Black population part of town, but you're the only Black nurse, for miles around. It's crazy. What is your message? What is the message you have for a young minority student interested in healthcare?
Okay. Yes. So, well, I started from the bottom of the nursing spectrum. And as I told you, I progressed in my piecemeal fashion to balance my family and work. I started out as a certified nurse assistant, as you mentioned earlier, and
Mm-hmm.
doing the secretary and the basic rudimentary things, because I started my family started young. And then I went on to become a licensed practical nurse after that. And then I went on to become a registered nurse with an associate's degree. Then I went
Mm-hmm.
on to become a registered nurse with a bachelor's degree. Then I
Mm-hmm.
went on to become an advanced practice nurse with a master's. And then I got my doctorate. So as you see it, and that was a span of, I started nursing when I was 20, and I've had 25 years in, over 25 years in nursing, and have held every position that's available in the field. But it took all of that time, about 1 to 2 years each time, so that I could balance and continue to work and help support my family. So many of minority nurses are going to find themselves in that same similar predicament, and trying to figure out, well, how am I going to reach this goal, because the path is not conventional. It's not but it's just as rewarding.
Yeah.
I'd say it's just as rewarding as the traditional way in which college is typically known for, the 4 to 5 years of, of trying to get through. But no, in with a lot of these nurses, they're just not able to sit and do that. Either they don't have it socially, it's not economically sound for them, um, their family lifestyle and their cultural and behavior factors that just don't allow them to do it in that fashion. So um,
Leisha, I have to ask you this. This is the other side of it now, devil's advocate, right? So you bootstrapped your way up, okay? And I'm not saying, it's ideal, you wish you were different, but you had certain cards, and this is how you played your cards, and here's why. That's why you're here
Yes.
today talking. And like I mentioned before, when I go to the hospital, I see a lot of black CNAs and HHAs, and so in the few minutes that we have left, I want you to speak to me about mindset, okay? Because you had a certain mindset when you made the decision you weren't going to remain a CNA. You were going to take the next step, and then you got to that next step, you got to take the next step, and the next step, and the next step. And I think if you can leave a message today is about mindset. How can one develop that mindset? Because again, you were internally driven, externally you weren't getting the support, the traditional support, but you had internal drivers that allowed you to, step it up from CNA, which we know is, $8 an hour or whatever, and to keep going up and up. So speak to that CNA. Speak to the CNA in the audience right now. The CNA in Memphis, a question was asked, can we recruit minority healthcare professionals from Memphis? I would say, Peter, yes. But I'll let Keisha answer that. Can we recruit from locally from Memphis? What do you say?
I like his question because it goes back to what you mentioned earlier about leadership in healthcare, and that
Mm-hmm.
I wanted to I think he brings up a good point. Um, when you mention the healthcare leaders at the hospitals, and their responsibility in recruiting and getting in minority healthcare providers, one thing to consider is that the leaders themselves have to be aware of the unconscious bias that occur.
Yeah.
As I told you, in my area, it's just me. So the leadership actually is in my
Yes.
in my hospital, in my facility, is majority. I think there's only one or maybe two minority on the leadership team. So when you have a leadership team that is comprised of group of people, then they may not be aware that these biases are there, and so their recruitment efforts are not going to be as robust as you would think they would be. So you've basically got other people talking to other like-minded people, so you're not going to see them getting out there and recruiting, and it just may be because they're not aware that there's the necessity of having the minorities there. You have to have in the leadership within the hospitals and within these facilities, there have to be diversity within the leadership in order for there to be diversity within the workforce. And so I think that's what when I see Dr. Peter, and I apologize, I do not want to mess up your last name, but I think
I
you
can't
can
pronounce
recruit
that name either.
minority. Yes, I think you can recruit minority healthcare professionals in a city like Memphis. Um, but I do I think it's a little bit there's some it's it may be a little bit difficult. I think we've seen that. We're like I said in my particular facility. We're in 2023 and we still don't have, but maybe 1% representation on a leadership team.
Yeah.
That's making the decisions.
So what I think you're getting at, Cleisha, and I do agree. I really wish that diversity did not get a bad name, DEI, because there's so much good. It's so important. It's so needed. And when you're discussing, when you were talking about the leadership team where you're at, all I kept thinking, the word that kept coming to my head was echo chamber. Echo chamber, meaning that we're talking to each other in the same language and we're not understanding. And so we're hearing each other, talking to each other, echoing back each other. But then the broader, more expansive thinking is just not there because it's an echo chamber. There's so
Right.
many echo chambers in all industries, but we need an echo chamber to we need to shift the echo chamber in medical because people are dying and because people are
Yes.
being treated unfairly. And it goes back to a leadership thing. I don't want to get political, but I know that this current administration is trying to do a lot with cancer, with the Cancer Moonshot Project. And I hope to see, I don't care who, who's in power, if they would just continue some of these initiatives and distill it down
Absolutely.
so that we could stop the madness. Jennifer said it's such an important topic. I'm volunteering with a local organization that works to get Black students as early as eighth grade on track to prep careers in advanced healthcare careers. We have to start early. Totally agree with you,
Absolutely.
Jennifer. Yep,
Absolutely, Jennifer. Yes. Yes.
yep. And
Yes.
then Peter said this
Absolutely.
is a great point about leadership in recruitment. It should absolutely be encouraged locally. And then Sarah said, Jennifer, Sarah responded to Jennifer, this is the concept of breaking generational chains. We have to level set young people to believe they are worth more. The word that Sarah emphasized there, the word believe. See, as what I said to you, Clesha, mindset. You know,
Yes.
mindset is so important because of some of these historical factors. Um, there might be, there are questions about people's worth, right? And so,
Yes.
as Sarah pointed out, we have to get young people, minority young people, to believe that they're worth more, capable of more, destined for more. I even think eighth grade is too late. And then Sarah also said, we need you in positions of power and influence to tell your story. You started by saying public speaking is intimidating, but your words and experience are so powerful. Keep speaking. Because, Cleisha, as I want to underscore what Sarah said, because you have that story of the non-traditional approach. CNA. I mean, how many CNAs we know are around? A lot, right? Hundreds and of thousands, maybe millions, because it's the lowest tier. It's the lowest entry point. But you went from CNA, you could write a book from CNA to, to
Mhm.
where you're at
Yeah.
now. And again, I'll say this again as we're closing down here. I promise it will be 30 minutes, but I told you, girl, it's I can't control it. I can't control the timing sometimes. But Cleisha, just say, I want you just to give a charge. And I remember this CNA who worked with my mom for a few years. A lovely, lovely young lady from Haiti. And she always had ambitions of doing more and doing more. She had a little bit of a language barrier, and so she was trying to learn English. There was a lot of barriers, but she had that passion. So I want you to talk to her and those CNAs that you see in the Memphis system who are, just trying to get by. How can they
Yeah.
become like a Cliche? That's
Yes.
how we're going to end it.
I Yes, yes. I think they need to find what drives them and what motivates them to want. For me, it wasn't just self-motivation. I did have other people who I saw, um who who motivated me to want to continue on. Particularly, my aunt was diagnosed with leukemia when I was a teenager, and that forced
Mhm.
she it resulted in her having multiple hospitalizations and forced our families to have to come together. And I spent a lot of time with her, but I couldn't go to the hospital to visit her because it would make me just literally sick. The smells, the sights, the sounds, all of it was just overwhelming for me. And so that was in turn my motivation for wanting to get up and overcome that barrier. So I say for anyone, especially being a CNA, once you are get started and you're working with patients and you find out that you have that desire to serve, you find that thing that motivates you to keep going. So my desire to want to go and visit her at the hospital one day, um, then one was what was the catapult for me going on into becoming just a CNA. And then once I got to becoming a CNA, my desire and my love for wanting to serve and seeing the few Black nurses that I did see and how they cared for, and not just Black nurses, there were white nurses. I had had a lot of mentors in a variety of settings that really showed me how nursing and what serving was. So it was that was the motivation, was to serve. So if you're a CNA and you have a desire to serve and you love working with and helping, patients who are challenged with these diseases, whether it's cancer or other comorbidities, then I would say, you know uh, press forward, find out what motivates you, find that thing that pushes you and propels you forward to want to continue on, and then find someone who it can be an advocate of yours. For me, my mentor came to me, and I think having a mentor is extremely important. That would be probably my number one advice that I would give to anyone, is find someone who can mentor you and continue to push and propel you forward. And I had many of them that I found that were very helpful as I pushed through my career.
Well said. I feel like the universe, which of course I believe in God, not universe, but is speaking to me today because this is a second heavy conversation I've had about mentorship and the importance of mentorship. And so, it's a beautiful ending. Beautiful ending. Peter says, "Thank you for sharing this work on Tea Talks today. I wish you God's blessings on your mission, and I hope you will continue to be loud and encouraging with the message for young people." And I certainly agree. I love what you said. To the CNA, and I think, find out what drives you. And the second important thing was seek mentorship. Doesn't matter what color they are. If you find someone who identifies with your values and your belief, seek that mentorship and move up.
Absolutely.
Clesha,
Yeah.
thank you so much for being here
Yes.
today. You did
Thank
great for
you.
your first one.
Wow, I thank you. You made it easy. You helped that a lot, and I really appreciate it. This was fun.
It
I hope to
was,
see
and you
you
were
again.
relaxed. You can do more of these. Okay, this was your first one. It shouldn't be your last because you have a
Mm.
message. You have something to say. I think you're in a very unique position, especially because of the non-traditional approach to where to get where you're at. I think you'd be very inspiring in some of these more, black schools. You should go on a little bit of a circuit, right? And let them
Yeah,
see you as an example. So I really thank you for the work that you're doing. Thank you for being on today. Thank your mentor for making you do this. And we hopefully will have you on here again. And don't go, Keisha. I'm going to say goodbye to the audience, and then I'm going
okay.
to just wrap it up with you a little bit. But thank you, audience. We'll be back here tomorrow at 2:00 with our next Tea Talks with Total Health. Take care.
Thank you.